Government wishes to stress its readiness to further engage with a view to implementing the conditions of service in a manner that does not dislocate the national budget. We wish to draw attention to the fact that the conditions of service under reference are not captured in the 2025 budget and will completely throw the economy off gear if implemented immediately in the manner it currently exists. We are mindful of the serious economic consequences of unbudgeted expenditure and want to avoid the economic slippages that led to the hardship in the recent past. Government commits to continue to engage with the nurses in order to achieve a mutually acceptable outcome in the interest of the public. While working around the clock to resolve the impasse, the Ministry of Health has taken the following steps to mitigate the suffering of Ghanaian patients unduly affected by the strike. The ministry will, in the next few minutes, publish a comprehensive list of facilities to complement facilities where nursing services are lacking and where patients can seek health care. Given the urgency of the situation and suffering of the patients, government appeals to public-spirited retired nurses and midwives to volunteer their services for a brief period pending the resolution of the impasse. We further express our deep appreciation to practicing nurses who have opted to remain at post to help suffering patients and urge others to show similar fellow feeling and assist our ailing compatriots even as efforts are made to address their concerns. In conclusion, government reiterates its commitment to dialogue with the GRMA with a view to resolving this impasse for full nursing services to be restored. Thank you for the opportunity.
Thank you very much, Honorable Minister. You may have heard him speak about the implications for the national budget in the event that the conditions of service as they exist are implemented immediately. To shed further light on that, I would invite to the microphone the Honorable Thomas Ampim, who is Deputy Minister for Finance. Thank you very much.
Good morning. We've all heard the Minister for Health, and from the Ministry of Finance, we want to show our commitment to help in resolving this important issue, because our nurses are very, very critical to healthcare delivery, and we appreciate what they do. But the reality is that we have over 120,000 nurses, and the implementation of the current condition of service that they are demanding will have serious consequences for the budget. In fact, if we fully implement it, we are going to add in excess of 2 billion cedis to the compensation budget. We have all committed that in our resolve to reset the economy of this country, we must maintain a 1.5% primary balance surplus every year in order to bring our debt levels to sustainable levels. And so it is important for us to manage expenditure. And so we want to appeal to our revered nurses that we are willing to negotiate, to sit with them and the Ministry of Health to agree on a roadmap that will help us incorporate what can be accommodated in the budget for next year. And we believe that they have all seen the hard work we are all doing to manage the economy better. We want to appeal to them that they should let us sit down and discuss what can be accommodated so that we can all have a win-win situation for all of us. Thank you.
Thank you very much, Honorable Deputy Minister. The floor is now open for any questions that may be agitating your mind on this particular issue. Please raise your hand. I will acknowledge you, and then you ask the question. Yes, Komla.
The nurses say that they started the engagement way way ahead of March, where the budget got kicked in, and then the assurance they had from the Ministry of Health was to the effect that their concerns or their conditions of service would be captured in there. They now say that it's out of bad faith that you have not captured it in the budget, and you are now referring to a possible implementation of 2026. Would the government then be willing to pay the arrears that they may be foreseeing?
All right. Any other question, please? I just want to take all the questions so that they answer it.
Okay.
In composite. Yeah.
Yes. Okay. My name is Maxwell Agwagba. I work with Joy FM and Enjoy News. My question is, I'd want to find out, would you describe this as an ambush, or was it something that government anticipated? I'm asking because during the transition period, I know there were many discussions, and one of the important components of those discussions was in the health sector. Did government anticipate this? Would you describe it as an ambush? What would you describe it to be? And where do we go from here? Thank you.
All right, so the minister made mention that government is going to outline some facilities that nurses could volunteer their services. And then the retired nurses should also come and support. How long are we looking at?
If I may clarify that, he said that he was going to publish a list of healthcare facilities that will complement existing healthcare facilities where this strike action has taken place. So that is what he said he would publish. The call on retired and voluntary, retired nurses and midwives is for them to assist at the places where the strike action has taken impact. So that is a clarity that needs to be brought. But I would invite the Deputy Finance Minister to speak to the bit about negotiations that may have taken place in March, as you say, and what can be done going forward. Thank you very much.
Thank you. I don't want to describe any act as an ambush or any deliberate attempt at government or whatever. I think that our nurses are pushing for what they want. It is for us as government to also look at what can be accommodated within the budget. And you will all appreciate the fact that it's a new government that took over. And we have been confronted with many, many, many things. We have to balance everything and ensure that the economy is not thrown out of gear. We have a lot of debt that we need to, we have been confronted with. And so, in as much as I appreciate what our nurses do and what they are demanding, we also want them to have faith in the current administration that we mean well. And we are committed to ensure that we have a fair wage for what they do for all of us. And so let us not describe their action in any way that will mar our attempt to resolve this issue. Thank you.
Thank you very much. We'll draw down the curtains here, except to add that government's doors are open to... Well, those are matters that can be looked at once people sit around the table for discussions to be had. So the invitation to members of the Ghana Registered Nurses and Midwives Association still stands. And all right, so the Health Minister would want to make some concluding comments on the matter.
Yeah, thank you very much. And as a mother ministry, we want to still appeal to our brothers and sisters who are nurses to come around the table so that we have lasting solution to this matter. And I can assure them that as a ministry, as their mother ministry, we are the best people to pursue their interest, and we are committed in doing so. Thank you.
Okay. So thank you all for coming. See you another time.